What's up, everyone? Welcome back to the show. We are continuing now in one of my favorite places here in Manhattan. We are at the Victory Clinic with Dr. Clark. Doctor, thanks for being with us today.
Thank you.
Yeah, this place is awesome. Right when you first come in the doors, you just feel a sense of peace here. Tell our viewers about what you do.
Thank you. So Victory Clinic is a TMS and SPRAVATO treatment center. So we're here for people who medications have failed to put them in remission with their depression. And the two main treatments we have are TMS, which is transcranial magnetic stimulation. And then our second treatment is SPRAVATO, which is a nasal spray for treatment-resistant depression. So in about half of people who have medications prescribed to treat their depression, those depression medicines fail to put them into remission.
Yes.
And with suicide being a top 10 cause of death, we have these tools other than medications, and I think it's really important that people know that these tools are out there.
And talk about the timeline for these treatment options.
So for TMS, most of our protocols run between 30 and 60 treatments. Insurances that cover these treatments typically pay for one treatment a day, so 5 days a week. So it can take someone 6 weeks up to 3 months to get through a whole TMS protocol. Now that said, our system is very advanced. We have the MagVenture system, which is the only systems in Kansas that are capable of running theta bursts, which are 5-minute bilateral treatments for both depression and anxiety.
That's awesome. And
they can get through the whole protocol in a week. So even though insurance doesn't cover that, that's a very ideal treatment for professionals who can take a week off. So this SPRAVATO, the nasal spray, it is federally mandated that we observe these patients for 2 hours each time they get a treatment. It is twice a week, so a 2-hour treatment twice a week for 4 weeks, and then once a week. And then as the person tolerates, if they stay in remission, then we begin to space those treatments out to every other week, and or so on. That's why we have very comfy recliners. We keep everybody very comfortable, let them listen to music. Some people like to draw, some people like to write, some people like to just take a nap in those 2 hours. They can use the time how they see fit. Some even incorporate their therapy into those 2 hours.
And if people want more information, you actually are having an open house here tomorrow. Tell us about that.
Yes, we're having an open house here tomorrow. We're very excited, and a ribbon cutting. But the most exciting thing is we're going to let people see the clinic. Let them see the chairs and let them see our Neuro Navigation system.
Yeah, it's pretty cool.
And it is very important to me to destigmatize mental health care. And I think when people see, when we map people and they realize my depression's here, I'm going to get treated here with the TMS, my anxiety's here, I'm going to get treated, that helps destigmatize it. And that helps take away judgment and blame, and everybody's worthy of wellness. Everybody's worthy of going into remission from depression and anxiety.
Yeah, I love that. And Dr. Clark, this is not your only location. This is your second location. Your original location is over in Junction City. If anyone wants information about either of these clinics, how can they find that?
So they can go to our website, which is victoryclinics.com. There's actually a messaging service on that. It's called Clara. It's secure. And message us at all our clinics. And get the help they need.
Yeah, well, that's fantastic. Thank you so much for having us in today, Doctor.
You're welcome. Thank you.
Yeah, make sure you come check out Victory Clinic here in Manhattan, Junction City, or their other locations across Kansas. We'll have more on Good Day Kansas coming up next.